Hi everybody, it's August 14th, 2010, and this is just one more. Today's show is going to be a little bit about comments, and a lot about questions. The number one question for all Canadians should be this immigration thing. That boat they found in Vancouver, well, they didn't just find it, they knew it was coming. We got to figure out what's going on with this immigration This is the second boat. It's not the first. 490 people? These guys are the same people that used to use children to fight their wars, aren't they? Am I wrong?
Medical staff in Victoria were prepared for the worst to deal with the sick, with hundreds of people crammed together on a small freighter at sea for months. It turned out, though, only a handful of the migrants were taken to the hospital. And tonight, health authorities tell us the migrants are in good condition. Most of the patients who were admitted will be treated and discharged soon. Our Louise Hartland joins us now with that part of the story. Louise.
Hudson, the Vancouver Island Health Authority has been preparing for the migrants' arrival for months. Today, its first patients arrived. This is the only glimpse we got of one of the migrants arriving at Victoria General Hospital. After months at sea, passengers aboard the MV Sunsea are being assessed in Esquimalt, and those who need extra medical attention are being moved to Vic General. One by one, ambulances started arriving at 11 this morning, greeted by masked medical staff. Each ambulance and van carried one patient, with the exception of one, which carried two. In all, we counted 8 people coming in to be treated. The hospital has reopened the old emergency ward to provide screening, triage, assessment, diagnostics, and decontamination. VHA says patients who need to be admitted will be kept separately from non-migrant patients. Although they wouldn't go on camera, the Vancouver Island Health Authority says patients are being treated for nothing more than you would see at a normal walk-in clinic. And they say the people of Victoria have nothing to worry about. Esquimalt Wanda Fuca MP Keith Martin is a doctor and has spent a lot of time in developing countries overseas. He says the migrants will be in good hands in Canada.
And these individuals will receive top-notch and a thorough assessment by our physicians, nurses, and other caregivers here.
These two Tamil-speaking doctors have flown here from Ontario to volunteer to help. They both know the risks of having nearly 500 people in a small boat for months.
Tuberculosis is number one concern. If there could be one active tuberculosis, it could be spread like wildfire. Gastrointestinal diseases, respiratory illnesses, and I'm not sure what's the sanitation there. But people can have all sorts of disease, including choleras.
Martin admits treating the migrants will come with a hefty price tag.
The cost of this, again, will be borne by Ottawa. It must be borne by Ottawa and not be borne by Vancouver Island Health Authority because these costs are deemed to associate with a national problem, but our local authorities cannot be the ones to be responsible for it.
But the cost of treating these migrants is the price you pay when you live in a country known to have a humanitarian.
Canada received 34,000 refugee claims. Most of them came across the United States border, or most of them flew in by plane. Is this boat thing a big thing now? An estimated 250,000 people live in Canada, mostly around the Toronto area. It's said to be the largest population outside Sri Lanka. Maybe the arguments about immigration should get like the fever pitch they're getting in the United States. What do you think? Are our immigration laws too lax? Leave your comments and questions below, and let's have a little debate on it. There's lots to be said, I'm sure, and I'll be doing lots more to come. You can find this guide on YouTube. These guys were immigrants, and they've made a book to show you how easy it is to come to Canada. I'm not sure if I like that. Doesn't Canada have their own books?
Hi, I'm Nick Narani, author of Arrival Survival Canada, founder, publisher, Canadian Immigrant Magazine, and this is my wife Sabrina.
And I'm the co-author of Arrival Survival Canada and co-founder of the magazine.
Arrival Survival is a handbook for new immigrants. It gives you the information before you come to the country, what to pack, what to bring with you, what are the important papers that you need to carry, as well as the information that you need for the first 2 years of your life in Canada. Now, this country has wonderful systems, and when I came here, I looked around and I found that a lot of the systems you need to go to several departments to get the information. Information from friends and relatives and neighbors, frankly, was probably outdated and not very accurate. So the idea was, what if we could create, my wife and I could create a book as a one-stop information source for immigrants. And that's what Arrival Survival is.
Thank God we're Canadian, but at the same time, what does it mean to be Canadian? Anyways, that's my vlog for the day. Hope you enjoyed. That's just one more. Talk to you tomorrow.